Let me ask about some of the Alaska-specific initiatives. As you know, and I've discussed with many of your predecessors here, village-built clinics have had an important role in Alaska. We've got about 150 in Alaska, with most of these being the only local option for health care. Most of them have some pretty significant maintenance needs. In the past, the agency took the view that the tribes were responsible for paying for these costs out of other funds that they get from the service. And in 16, we included $2 million to help address this issue. Last year, the administration put $11 million in its request for these clinics, which the subcommittee fully funded. And then this year's request takes us back to the 16 amount of $2 million. So a couple questions here regarding VBCs is how the agency plans to allocate the $11 million for FY17. When will these funds be distributed? And then just the rationale for cutting back from the $2 million from the 11 that had been requested. And what I'm trying to figure out here is what is a sustainable level for us on an annual basis to fix the maintenance issues that we have with these clinics. We felt like we got our foot in the door back in 16, but you can't do much with $2 million when you have a level of need as we have within the state. So if someone can speak to the issue of where we are with village-built clinics in the state.
Yes, ma'am, and definitely the VBCs or the village-based clinics are an integral part of our Indian healthcare system. I'd like to ask Ms. Fowler to provide.
Sure.
So the 11 million, we do appreciate that those funds were included in our fiscal year 17 appropriation. We have currently allocated 6 million to the Alaska area. 2 million represents what was funded last year, and so those are being allocated to the same clinics on a recurring basis as last year. The additional 4 million that's been allocated to date is undergoing tribal consultation. That 6 million is specific to the village-built clinics. There are additional tribal clinic leases similar to the village-built clinics that also require funding, and so that meet the criteria for the funding. And so the other 5 million for the meantime has been set aside to determine as we evaluate the need to fund those clinics, the majority of which are in Alaska at this time. All of them are in Alaska at this time. And so by the end of this fiscal year, we'll be able to give you a complete accounting of how those funds were allocated.
So do you think that by the end of the fiscal year, you will have provided the schedule for the remaining balance of the 5 million?
Yes.
Okay, and then to the question of what do you believe could be a sustainable number on an annual basis for meeting the maintenance needs for these village-built clinics?
So as I indicated, we have another group of tribal clinic leases that have emerged as a funding need, and we are in the process of determining. And some of the village-built clinics actually cross over and are part of this other group as well. And we are currently evaluating how much is needed to fully fund those leases. I believe that the last estimate for the village-built clinics specifically was in the range of $16 million, if I'm not mistaken.
So it would be helpful for me if we can have that kind of analysis in terms of what we have out there, what the need is, and kind of building a schedule, if we can, so that we can understand how we can best address this and map something going forward. I think that that would be helpful, so if you'd be willing to work with us on that.
We are willing to work with you on that.
And then on our small ambulatory clinic program, again, in FY17, we had $5 million for the small ambulatory clinic. This was the first time that we had been successful in including money in the program since 2008. It has been very helpful and successful as we've used funds to construct facilities. We've got them out in Tooksuk Bay, Chiniga, Cake, Hooper Bay. We've also had many groups that are interested in submitting proposals for the funds that are provided in FY17. Can you tell me how many proposals you've received for the funding, and if any decisions on funding allocations have been made yet?
And we'd like to ask Gary Hartz to
Okay.
weigh in on this one.
Thank you, Senator. As you indicated, the small ambulatory program is extremely popular. And in fact, in '08, when we did that solicitation, it is a competitive program as well. When we did that solicitation, we got 67 applicants. And in varying levels of need to complement their plans for small facilities. Our dollars that were dollars appropriated to IHS for this purpose is often used to leverage other resources. And I can come up with examples of leveraging that went up to 6 times, where $2 million was put in, which is the cap that we would provide under this program. Funding, being part of a funding package, it would run $10 to $12 million. Where are we at on the solicitation for this year? I will conservatively tell you that it'll be on the street before the end of the fiscal year. It will be done before that, but I will tell you that based on the appropriations that passed and the fact that it included money for small ambulatory, we are in the final stages of review of the package to get it out on the street for solicitations.
Well, Mr. Hart, you've recognized that it is popular, that there is a need, and unfortunately, the budget proposal doesn't include funds in FY18. So again, this is an area where we think we found a way to help address some of the needs that we have, particularly in our very remote and small areas. So I would like to think that we would be able to continue a level of support for our small ambulatory clinic program.
All of the authorities provided are helpful in addressing the needs across Indian country. Thank you.
Senator Udall.